Hello, and welcome to our presentation of the ethical and legal case analysis of Ms. Johnson. Our group is pursuing our master's in biomedical science at A.T. Still University. This is for our medical ethics class, and this case evaluation is presented by Hira Ali, Melecia Martho, and Vahagn Grigorian. The next slide introduces the case summary. This case is about Miss Johnson, a 73-year-old female who lives with her son. She has a history of poorly controlled heart failure with frequent hospitalizations. She presents to the ED confused and hypotensive. Upon further examination, CT shows she has a bowel perforation. IV fluids have improved her condition, but surgery is still recommended, even though there is only a 20% chance of survival. Miss Johnson's heart rate and BP begin to decline, so the surgeon contacts her son. Miss Johnson is very upset that her son was notified, and she still refuses surgery. The next slide is about the chaplain role. The role of the chaplain is to spiritually guide patients through this part of their journey. There are spiritual concerns, emotional concerns, and existential concerns. We'll first talk about spiritual concerns. Miss Johnson has identified as a practicing Catholic. Many Catholic patients express preferences for dying at home, surrounded by family and familiarity, avoiding burdensome interventions and meeting death with acceptance. The chaplain would gently explore things like, tell me what peace means to you right now. What does preparing to meet God look like for you right now? Then we have emotional concerns. She has a desire not to burden her children. This refusal could stem from her own past with her kids, just not wanting to be a burden, guilt about dependency as she was very independent, feeling ashamed or feeling like a problem. Older adults who are usually independent want more privacy towards the end as to not feel too dependent on others. She also has a possible fear of conflict or family pain and for grief and loss. There is the last concern, which is existential. She needs the autonomy of the end of life decision to maintain agency to define the terms of her death. This is supposed to be a meaningful experience for her. She might be asking herself these questions of how she lived her life. What will death mean for her and for she and her family? There's also a fear of prolonged suffering, a painful surgical recovery, dying in the ICU, being kept alive in a very dependent state. Also, there is desire for control during vulnerability. The next slide shows her preferences. Again, she is electing to not have surgery and she does not want her family involved. Miss Johnson would like to die at home and she does not want her family aware of the situation. Ethically, it is important to keep in mind that although she has this preference, she was admitted into the ED with symptoms of delirium. Per HIPAA, when a patient is not medically sound, the ethical principle of beneficence can be applied, meaning a provider must do what is best for the patient. So although no surgery and no family involvement is her preference, ethically, we would still follow HIPAA if needed.
Okay. Hi, everyone. My assigned role in this case is as the attorney. And as the attorney, my job is to analyze the case through the lens of the Pennsylvania state law. That includes understanding who legally has decision-making authority when a patient like Ms. Johnson loses capacity, what rights the patient herself has, and how previously expressed wishes, whether written or verbal, should guide medical care. I also evaluate how the medical facts of the case interact with legal standards, such as in advanced directives, surrogate decision making, hierarchy, and the requirement to honor the patient's known preferences whenever possible. Medical indications. From the medical side, Ms. Johnson is experiencing a small bowel perforation, which is a life-threatening emergency. Without surgery, the likelihood of survival is extremely low due to the rapid progression towards sepsis and organ failure. However, the surgery carries its own risks. Her advanced age and her significant heart failure makes the operation a high risk. with a substantial chance of complications. Even so, the surgery is still considered medically appropriate and the standard of care. It is not considered futile or experimental. Legally, the fact that surgery is medically indicated matters because Pennsylvania law requires surrogates to base decisions either on the patient's previously expressed wishes or, if those wishes are unclear, on what is in the patient's best interest. When a treatment is medically appropriate, as the surgery is here, the question becomes, did the patient want it? And if she cannot decide now, who is legally allowed to decide for her? So the medical indication tells us that the surgery is the only life-saving option. But the legal question is whether her early refusal, given while she had partial capacity, should override the son's surrogate authority once she becomes incapacitated.
As an ethicist, my role is to balance the key principles related to the ethical decision making. The first thing to check in this case would be whether or not Ms. Johnson has decision making capacity. It was clear from the clinical case that her cognitive state changed during the hospital stay, which is why it's important to confirm if Ms. Johnson fully understands the risks and the consequences of refusing the surgery. Ethically, the right thing to do is to respect her autonomy, but we also need to take into consideration the beneficence and the non-maleficence. Ultimately, the goal is to do what's best for her without hurting her. There's also an ethical issue that revolves around her wishes and her son's wishes, and the team needs to look into all options in order to balance her values with the family's concerns. With surgery, there is a very low chance for Ms. Johnson to survive. Research shows that adults, older adults with comorbidities that undergo emergency abdominal surgery usually end up with significant complications, leading to prolonged recovery and major decline in their functionality. We know that Ms. Johnson will most likely die if she does not get the surgery, but with respect to her wishes, care can focus on comfort, symptom management with palliative care. Palliative care focuses on the quality of life and it emphasizes on the patient's own values and goals and not what family members want. Ms. Johnson repeatedly stated that she wants to die peacefully and is spiritually prepared for it. Based on this, it is obvious that her preferred quality of life is comfort and maybe also not burdening her family members, which is why surgery might not be the best choice of action. The contextual features for this case revolves around legal, family, spiritual, and hospital factors that affect the decision making. Ms. Johnson does not have an advance directive, and her ability to make decisions does fluctuate. This does raise legal questions as to who can make the decisions on her behalf. According to Pennsylvania law, even though she did not want her son to be notified, regulations say that surrogates needs to make decisions on her behalf, which means that the son can be notified and act as a surrogate. However, ethically speaking, the hospital should have respected her wishes. Her Catholic faith and her wish to die at home shows that spiritual beliefs are important for her. In regards to family involvement, Ms. Johnson did not want that. However, research does show that involving family members and having access to palliative care does help support patients.
A group recommendation, first would be to respect Miss Johnson's wishes. If she does not want surgery, then it should not happen. And then assess and document her decision-making capacity thoroughly. Provide palliative care. Provide palliative and comfort-focused care. Offer chaplaincy support for spiritual needs. communicate with family while respecting legal requirements and patient privacy, involve ethics and legal teams if needed.
For reflection, my reflection is that not every decision in healthcare is easy to make, but in most cases, it is important to respect patients' wishes. It is also important to know the legal limitations and to be able to make ethical and moral decisions when caring for patients. Also, this case is a perfect example to have an advance directive for a patient chart in case of emergencies to respect the patient's wishes.
My reflection is that patients deserve a right to conduct how they want their health handled. I do believe it is important that a provider give the patient resources and offer other perspectives so the patient is making an objective decision. It is important to present these perspectives in a non-coercive way so that a patient does not feel forced.
My reflection is that it is legally and ethically the patient's right to decide how she would like her care handled, and if she decides not to have surgery, then it is 100% her choice. I've always been a firm believer in that it is a patient's right to make decisions about their care. And I didn't add this, but I also believe that all members of the healthcare team should try their best to communicate with the family and the patient.
These are the references. Thank you so much.